Nigeria has now become the third most impacted country in Africa by COVID-19 after South Africa and Egypt. More than 11,000 cases have been recorded and 314 people have died from COVID-19 related complications. About 812 health workers on the front line of response to the pandemic have been infected, according to the Nigeria Center for Disease Control. Now, June the 6th will make it 100 days in the fight against COVID-19 in Nigeria. Now, the big question is, how is Nigeria faring in the fight against COVID-19? This is the big question. Now, a lot of people, when they watch the presidential task force enlighten the people, update the people on a daily basis, some people are following, they're just watching, but they still ask the question, what is government really doing? All of those things are there, but certainly they have to pay more attention to what is going on. Everyone is on board, especially health workers. Joining me now via Skype is Dr. Osahon Enabulele, President, Commonwealth Medical Association, and former President, Nigeria Medical Association, and Chief Consultant, Family Physician, University of Benin Teaching Hospital. Dr. Enabulele, it's good to have you join me this morning. Now, when it comes to the African continent, let me start from the African continent. South Africa, Egypt, Nigeria are topping the list now of countries with COVID-19. But when it comes to continental response, how much of that is the African Union doing, or health practitioners, the experts at that level, including you, trying to galvanize, efforts from across the countries towards a common goal?
Well, I thank you very much. Good morning, Nigerians. The fact is that Africa has come a long way in its containment efforts with regard to COVID-19, the COVID-19 pandemic. There was a general situation in Africa where you had, because of the fragile healthcare systems across most of Africa, of course, the level of government commitment in most of the countries, there was a slow response at the very beginning. But I must say that through the anchoring of the whole containment efforts by the African Center for Disease Control, which of course is the African hub for in terms of disease surveillance and other response strategies, and of course with the support and collaboration of most of the African governments, knowing fully well that this was not a reality, I think there's been some tremendous increase in the response to the COVID-19 pandemic. So even in terms of even the facilities, a lot of African countries now can say, okay, at least they have one or two centers, diagnosis centers on the average, to of course detect cases of COVID-19. That was not the case at the very beginning. So you find a situation whereby there's now a lot of cooperation, a lot of galvanizing of efforts of all stakeholders, including the healthcare professionals. For instance, at the level of the Coalition of African National Medical Associations, which I coordinate, there's been tremendous involvement of the healthcare professionals in the containment efforts. Whether in Uganda, whether in Kenya, whether in Rwanda. I think apart from some countries where we're having some level of poor integration of the healthcare workers, particularly in Tanzania and some other countries, I think generally it's been some tremendous increase in the level of efforts, the degree of cooperation, the degree of collaboration, and of course the clear indication of progress, across most of the African countries. Yes, the cases are rising because you're now having some level of increased, laboratory support services in terms of diagnostic facilities being more available now to detect more of these cases in terms of active case searches that are going on across Africa. So I think somehow there's been some progress, despite the fact that there's still a lot more that should be done, including in Nigeria, where you still have a lot of issues surrounding public awareness creation, issue of belief and behavioral changes still needs to be attended to in some of these African countries, including Nigeria.
All right. From WHO to Bill and Melinda Gates Foundation to our ministries of health and even to the Commissioner of Health or some commissioners of health, especially like in Lagos, they have all projected that we have not even gotten to the peak yet. The days ahead could even be worse than what we have seen so far. In fact, putting it from the reports or statement credited to Bill and Melinda Gates, they say it's going to be horrible for especially sub-Saharan African countries. What we have now is even scary already. But when we look for, if we, based on these reports, if we have to picture that worst days ahead, from your perspective as someone who is coordinating the continental effort, what is happening and what are we looking at?
Well, I have always cautioned that we must be very careful the way we project information, especially across Africa.
Okay.
I do not think we should go up all the information we get from some external parties and external bodies, because again, all those statements are based on projections. Yes, there are models that have been used across the world, including China and some other countries in Asia. Yes, there is what is called the epidemic evaluation index, for instance, that is used to, and of course, what is called moving averages that you can use to model, your, interventions in terms of having some projections, by way of maybe forecasting what is going to happen in the days ahead. But like we all know, those are projections, and the reality on ground just now does not suggest that perhaps we are going to have, that we're going to lapse into those kind of very scary, scenarios. Because just now, yes, Africa figures have doubled in the last 1 week, from about over 80,000 plus. Now we have about over 162,000 plus in Africa. But if you look at even the death rates, it's not comparable to what you're having in Europe or what you've had in America or what you've had in some other parts of the developed world. So I think somehow, because of some other factors, we seem to be moving on, moving on steadily to a point where we can say, look, we are not doing very badly, and we may not get to those kind of terrible situations that have been painted by these external players. And I think this fear-mongering is not helpful to the whole containment efforts.
All right.
Because if people go into the panic mode, there are a lot of untoward effects that will arise from there. So the thing is to allay the anxiety, allay the fears, and get them to cooperate with all the public health measures and interventions that have been prescribed, while government and other stakeholders are putting hands together to curtail and contain, the COVID-19 pandemic.
All right.
So we must get people out of this panic mode.
Okay.
And do what we need to do in sync with our local experiences.
To bring an end to the trends. We must thank you so much, Dr. Osahon Enabulele, for your time on the program this morning. Thank you so much. Nigeria has now become the third most impacted country in Africa by COVID-19 after South Africa and Egypt. More than 11,000 cases have been recorded and 314 people have died from COVID-19 related complications. About 812 health workers on the front line of response to the pandemic have been infected, and according to the Nigeria Center for Disease Control. Now, June the 6th will make it 100 days in the fight against COVID-19 in Nigeria. Now, the big question is, how is Nigeria faring in the fight against COVID-19? Joining me now via Skype is Dr. Osahon Enabulele, President, Commonwealth Medical Association, and pastor and former president of the Nigeria Medical Association, and chief consultant, family physician, University of Benin Teaching Hospital. Dr. Enabulele, it's good to have you join me right now. Now, from the records we're seeing and the reports we're getting, government is doing everything they can. Health experts like you and the others are doing everything you can. The media is doing everything they can. What else is left to be done at this moment? Or is it just to sustain what is there? Because the numbers keep rising every day.
Well, the numbers rising reflects the fact that perhaps we are now increasing testing capacity, with a lot of states now having the ability to screen and test cases of COVID-19. So it's bound to show some increase, with the exception of 1 or 2 states that seem not to be doing much in terms of testing for COVID-19. So again, it's the fact that we've since entered the phase of community transmission, or if you like, full-blown community transmission in some states and local governments in Nigeria. So it's not surprising that you're having, a rise in the number of cases, because I had stated previously that Nigeria, in terms of what was happening, even in some other African countries, was not doing enough in terms of testing for COVID-19. So now we're beginning to see some level of, some some reflection of what really is happening in the field in terms of the number of cases that really exist in our country. And I think if we expand the testing capacity more, we're going to see more cases. So it's still evolving. We are not yet, we're nowhere yet, in terms of getting to the peak, because again, we did not, make some of these interventions on time, but it's better late than never. And that means that if we sustain our efforts in terms of the public health interventions, ensuring that there's some, more enforcement of some of these measures, particularly in terms of, some of those, public health interventions that have been, previously prescribed, in terms of even getting the people to adhere to them, and the use of face masks, for instance, the issue of social distancing in some communities and all of that. If we are able to sustain them, enforce them more, then we may, in the coming weeks, be able to see some level of decline and hopefully stability before we start talking about, a decline in the number of, a decline in the epidemiologic curve, that we have in Nigeria.
Now, as it is right now, beyond the issue of collating the statistics and data and the numbers and keeping records, what should the people be focusing on? Because it seems everyone knows what to do now, but it seems there's information overload or maybe information fatigue where people just go outside and do whatever they have to do. Talk to us basically as to what an individual should sustain doing and what they should do to ensure that everyone is safe.
When you talk about information overload, maybe that overload is more in the cities. My evidence suggests that in the rural communities where a lot of our people also reside, it doesn't seem that there's enough information, that has percolated into those areas. So, and yet they are Nigerians. Yet they are likely, going to be susceptible to some of these, and so susceptible to the infection, by the, virus. So it's something that we need to reflect on. You're talking about overload more in the cities. What has happened in the rural communities? Have we done enough in terms of engaging the communities in those rural communities? I mean, have we done enough in terms of carrying information to them at the grassroots in their local languages and in line with their cultures, building in their own cultural perspectives? Have we been able to, of course, change their behavior at those levels? Are they complying with the public health measures in terms of hand and respiratory hygiene? What is the evidence to suggest that they are doing so? So I think the overload is more in the cities because, again, in terms of, internet connectivity, in terms of access to, ICT, in terms of access to, television, radio, and all of that, we see them more in the cities compared to the rural communities. So I think in line with what even the PTF, talked about in one of their addresses, I think we should begin to see a manifestation and a concrete expression of that resolution to, of course, move more into the rural communities. All right. So I think that is what we should be contending with. Now, again, we also need to ensure that the health workers are not left stranded, even as we, of course, contain COVID-19, because the evidence suggests that a lot more needs to be done to actually protect the healthcare workers. And these are the foot soldiers that are in the front line, all right, containing this COVID-19.
Okay.
The frontline workers, on account of the information available to me, are not being well catered for.
All right, and that has to change because the passion from the health workers will go a long way, and the access to PPEs will help them do their work better. Thank you so much, Dr. Osahon Enabulele, for your time on the program. Thank you.